Okay, whenever there is lesion in cerebellum, this mnemonic you have to memorize that these type of signs and symptoms will be fine. Patient will have vertigo, ataxia, nystagmus, intentional tremor, slurred speech, hypotonia, exaggerated broad-based gait, and dystokinesia will be there. So the question is, in what kind of diseases cerebellar lesion will be there, and what kind of diseases will give all these type of signs and symptoms and findings. So there are three broad categories of the diseases, and those categories include the three categories include acquired malformations and genetic development. In acquired cerebellar disease include tumors, infarct, and hemorrhage. In malformation there is Joubert syndrome, Dandy-Walker syndrome, inferior vermis hypoplasia, megacisterna magna, rhombocephalosynapses, and Cari-1 malformation. And genetic development includes ataxia, spinocerebellar ataxia, Fragile X syndrome, 22q11, autism spectrum disorder, and ADHD. In these, cerebellar findings will be present, and you have now in ataxia there will be problem in balancing the body. There are different types of ataxia like cerebellar ataxia, vestibular ataxia, and sensory ataxia. So body positioning will be impaired and a person cannot position himself. That is known as ataxia. Acute cerebral ataxia can present. Now there is a Ataxia Telengectasia, that is a condition in which symptoms include trouble in walking and maintaining the balance, muscle twitch will be there, slurred speech with frequent infections will be there in telangiectasia ataxia, and its clinical features include cerebral ataxia, oculocutaneous telangiectasia, in which ear, neck, and cubital fossa is involved, and it is autosomal recessive. ATM gene is involved in this chromosomal instability, and it is associated with the it is increased sensitivity of ionized radiations. How can we find this condition? High serum alpha fetoprotein will be there, high carcinombrogenic antigen will be there, and low IgA, IgG will be there. So, uh, both cellular and humoral immunity is involved in this condition, and